Normally, people think making diagnosis from symptoms is like a matching game. Let me explain what I mean by that. When someone famous gets diagnosed with a disease, the media talks about that disease a lot. But what exactly do they say? They repeat the same pattern. They invite doctors and experts to TV and ask what are the symptoms of this disease. For example, let's call it disease A. All they talk about is how disease A has these four symptoms. Let's call them symptom 1, symptom 2, symptom 3, and symptom 4. What do people learn from that news? People learn that if you have the combination of these four symptoms, you have disease A. They also learn that if someone has been diagnosed with disease A, they are likely to have these four symptoms. But is that true? What if you only have 2 out of the 4 symptoms? Do you then have a 50% chance of having that disease A? Now, let's look at the bigger picture. Now we have 3 diseases to compare. Each disease shares some common symptoms with the other, but has a unique set of symptoms. Now, if someone has symptom 1 and symptom 4, does that person have disease A or disease B? If someone has symptom 2 and symptom 3, does that person have disease A or disease C? The more important question is, if someone has an exact match, is that person more likely to have that disease than the other disease with incomplete match? For example, if someone has a combination of symptoms 1, 2, 3, and 4, can that person still have disease B or disease C? So how do we decide where is the missing factor? The most important factor, the one that you should look at first, and the one that is almost entirely absent from this discussion and completely ignored by the talking heads on TV, is the patient. Analysis of any symptom must start from the patient. All these factors associated with the patient matter. You need to know that person very well before you try to make any sense of symptoms in that person. So what are a few things about the patient that influences how symptoms appear in that patient? The age of the patient, the gender, the body mass index, the occupation, level of physical activity, life experiences, smoking habits, alcohol use, history of any prior medical problems, and even personality of that patient matter. After you know your patient very well, you move on and analyze that particular symptom in detail, not just take that symptom on its face value to make the diagnosis. So you ask where exactly it started, what kind of pain it was, what made it worse, what made it better, how long did it last, and whether it was constant or intermittent. All these details and the patient factor give us a picture and help us decide what could be going on inside the patient's body. And this is how we make the diagnosis.